There's a lot of traffic that comes into Dakota Pharmacy looking for help with cognitive function. They're afraid of a family history of dementia or Alzheimer's, or they may even have some early onset of some memory problems that's very bothersome for them. We do have a couple things that can be very helpful. There's a track record with them. There's some science, some good science behind them. And we're going to talk about those two things and the difference. What's the difference between them? The first thing, and probably our go-to recommendation, and we've done videos about it, and had a lot of views on some of the videos we've done, and you might be familiar with it if you've seen any of those, and that's methylene blue, and it's one of our biggest movers. It's because there's some positive outcomes with it. There's some really good science behind it. So our go-to product for methylene blue is something called NeuroPro Plus. NeuroPro Plus is methylene blue and a little vitamin C. And when we get into the mechanism of action, just know that vitamin C helps aid the methylene blue get into the cells and how it performs. The other product is fairly new, and there's some pretty good science. To me, I think of it maybe as a little more of a natural remedy than methylene blue, and that's a mushroom extract called lion's mane. And lion's mane is, first of all, the mushroom looks like the mane of a lion. That's where it gets its name, but there's some cognitive function, some nerve regeneration associated with it. So we're seeing traffic on both of these, and we're going to talk about how each one works and the real difference. So back to methylene blue. So methylene blue is actually a synthetic dye, and it acts in a way that it boosts what is called ATP production. That's energy. Every single cell, and I'll draw a picture. Every single cell in our body has a mitochondria. That's the furnace. So think of your body as trillions and trillions of cells. Every one of those cells has a mitochondria, and that's the furnace. As we age, as we are exposed to toxins, stress, the mitochondria becomes rusty. That's how I like to look at it. Methylene blue helps polish the mitochondria. So in a visual, the mitochondria in the cells is a bilayered tissue. So it's round on the outside and folds on the inside. So nutrients come into the cell and they move through the folds of this mitochondria, and the end product is something called ATP. ATP is energy. So mitochondria is vital for health. It's vital for function. It's vital for normal function. It's vital for enhanced cell health. And when we think about the cells in the brain and what a beating they take, the mitochondria of the brain, and when we fix it, is being shown to actually help with the rust that causes the memory loss or the cognitive dysfunction. But again, it's a synthetic. It's one of the oldest synthetic drugs known. It's been around for a long, long time. It was used for poisonings. It was used during wartime for cyanide poisonings, and it's turned into more of an industrial dye. It stains everything blue, but and it's hormetic. So everything that is at a low dose can be beneficial. At a high dose, it can be toxic. So where you get it, the type of methylene blue that it is, the dose that you're using, and the time that you allow for it to work is really, really important. And that's why our staff is very, very well schooled. We've been working with methylene blue now for a couple years, and we learn from our patients. We're learning that they're coming back and saying, when I went from 1.5 tablets to 2 tablets, like you recommended, I really noticed a difference. I noticed a difference in my feeling of well-being. I noticed a difference in my energy level, and I noticed a difference in my brain fog. So there's a lot of science behind it. And there's some dosings by weight, but we really look at a very, very low dose. Typically, a half a tablet a day is not enough, but let's start there because I've seen some people that do okay with that. Let's start there and then gradually increase till we see some results. It really works on that electron transport chain in the mitochondria and improving the efficiency, which is critical for neuronal energy demands. So our brain is calling on these energy demands of the neurons to function properly. And that's how methylene blue functions. Let's move on to lion's mane. Lion's mane, at first got a hint that there was something to it. We started to see some people walking into the pharmacy asking if we had any mushrooms. We had a few immune function mushrooms, but we didn't really know a lot. And I heard the question enough, and lion's mane is what most people were asking for. And when I visit with them, I was certainly asking them, what are you looking to get out of using lion's mane? And it was cognitive function. So we went to work on finding a good company. What do we need to look for? Where's the best product? Where's the best outcomes? Took us a while, but we settled on a brand called Purest mushrooms, and this is a lion's mane bottle. And again, like I said earlier, lion's mane has a little bit more of a natural component because it's a plant. It's very popular in Eastern medicine. And we're now seeing some of the science being produced to show that it does help with cognitive function. And it works a little bit more. The bioactive compounds actually stimulate what's called NGF, nerve growth factor. So as we age, as we're stressed, as we have disease, the neurons and the nerve growth factors tend to become damaged, so that nerve function in the brain slows down and our thought processes slow down. So remember, I talked about how the neuronal energy demands that is required in the brain were fixing the mitochondria or giving it more energy helps. Your lion's mane actually increases the nerve growth factor and synthesis in the brain so that the nerves overall are more healthy. It's a longer process, but you're getting neuron growth and repair and what's called synaptic plasticity. So nerves are a system of their locks, their space. Transmitters come through, they jump across that space, and then they move. So thought processes, anything that we're doing typically is required for proper chemicals and nerve transmission through the highway of these nerves. And if you have good the space is called synapse. If you have good synaptic activity or plasticity, and especially in the hippocampus or the prefrontal cortex, that's where your thought processes happen. So that's where lion's mane tends to concentrate itself, is in the centers that are really responsible for the transmission of these neurotransmitters that allow us to process information, which is really only going to help memory process, brain fog, those kinds of things. Interestingly, both methylene blue and lion's mane have some anti-inflammatory properties. So inflammation is going to be a problem when we're dealing with cognitive function, and antioxidant properties. So there's some similarities in them as well. So antioxidants really slow oxidative stress. So if there's an excessive amount of oxidative stress, that's rust. That's going to rust the mitochondria. It's going to rust that synapse. Transmitters aren't going to move properly. So the more antioxidant activity we can have, the better off we're going to be. So some similar properties, some properties that are different, more of a synthetic chemical in methylene blue, more of a plant-based, natural properties of the lion's mane. The Purest mushrooms, one of the key things that we looked for after we did some research on what we were to be looking for is where are they getting the mushrooms from? Purest mushrooms, their mushrooms are grown on organic farms. A lot of companies grow their mushrooms in warehouses. So they're not getting the environmental necessities that a plant would need naturally. And the stems and the caps that are used from the lion's mane are really more of a whole plant effect. So it's more of a natural process that would offer the assistance. So when you're making that decision, synthetic, natural, that might help you decide that. It also gets to be what works. I can tell you from my experience over the last few years, nothing always works. Some things work better. It's an individualized thing. I can also tell you that we've worked with enough people. Their methylene blues helped a little bit. When we've added lion's mane, they do better. So they're doing both because their mechanisms are a little bit different and different enough and safe enough that you could do the two together if you needed to. Dosage-wise, we recommend a half a tablet of the NeuroPro Plus in the morning after breakfast for 2 weeks, then a full tablet in the morning after breakfast for 2 weeks. Let's kind of evaluate your progress. Most people are between the 1 and 2 tablets. The effectiveness of methylene blue is pretty quick. Potentially it can help in hours or even days. So sometimes people notice a rapid improvement, which is really unusual for more of a natural product. Nature takes a little bit longer. But again, this is a synthetic chemical. The lion's mane can take weeks to months. So as a plant, it just takes a little bit longer for it to show its effectiveness. That's why we almost always like people to start with the methylene blue, see if they don't get a little bit more of an immediate response. Sometimes it's enough. If they've done it for a few months and they're not really happy with the results, we either switch them to lion's mane or we add lion's mane to see if that combination doesn't make the big difference. So there's some more information on methylene blue and lion's mane, mostly for the cognitive function. They both help in other areas because of the anti-inflammatory and the antioxidant. But the real ask from the people walking in the door is, I'm looking for something to help with my memory, or I'm looking for something to help my spouse, or I'm looking for something to help my dad. And again, we've seen some results that I think are really pretty cool with both of these. But I thought it important that you understand the difference, help you make that decision, and we certainly will help with that. Our staff at Dakota Pharmacy is very well schooled in this. We talk about it a lot. So methylene blue or lion's mane, come and see us.